Cow's milk is absolutely not recommended for babies below 1 year. There are two kinds of proteins called whey and casein. The whey protein is more, casein is less. Cow's milk, this casein protein is like very high. It also takes time to develop that kind of trust with another caregiver. Secondly, just because a mom is going to stay away from the baby for so many hours does not mean that the mom needs to stop breast milk. When you abruptly stop feeding, your body has still not got the signal you don't have to feed. So the body is still making milk according to what your baby needs. Under the microscope, you can actually see living things in the breast milk. The immune factors, the antibodies, enzymes passing on from baby to mother.
Hi Divya, welcome back. Divya, I want to ask you about what are the trends or do you observe with working mothers? After 6 months they have to go back to work, and you had mentioned about gentle weaning, why gentle weaning is important, but they can't do it. So how do you help working moms?
Um, Actually, it's a very tough transition for both mom and baby. A mom might have mixed feelings about returning to work. Definitely a big adjustment for the baby also. So, if a mom knows her maternity leave is 6 months, by the fourth month, she should start, practicing, a few hours of separation from the baby, so that one sudden day, it's not that the mom is gone for 8 hours and the baby is with another caregiver. It also takes time to develop that kind of trust with another caregiver. So start with a few hours initially and then build up on the hours. Secondly, just because a mom is going to stay away from the baby for so many hours does not mean that the mom needs to stop breast milk or wean off breast milk. The mom can still pump and make that milk available for the baby in her absence. And baby can feed when mom is back. So with pumping, we can again give suggestions. So you need to make sure you have the correct flange size for your breast and nipple, and you need to understand to use all the different kind of settings. So we help them with how to get maximum pumping output, how to store that milk for your baby and safely feed it to your baby. Is it okay to store it outside? Should it be refrigerated? How should stored or frozen milk be warmed? How long you can store it?
So how long can you store up?
So a freshly expressed breast milk, it can stay outside at room temperature for 3 to 4 hours and be fed to the baby. If you're keeping it in the refrigerator, you need to keep it in glass bottles, are highly recommended because they don't react with the milk, help to preserve maximum nutrients in the milk. And these bottles should be kept at the back of the refrigerator so that with frequent opening of the door, the cooling isn't lost. And
In the freezer or in the
refrigerator for 3 to 4 days. And if you're freezing the
you
milk,
can store
3 to 4 days. Yeah.
Oh,
In the refrigerator. And in the freezer, you can actually store it for up to 6 months. Again, at the back of the freezer, or at least 3 to 4 months.
so you just allow it to just reach room temperature without, like how we have to make a cow's milk.
Yeah, correct. You cannot heat breast milk. So what you can do is, some babies are okay with cold milk. So you can give the baby as it is from the refrigerator. If you want to give room temperature, then you take it out like 30 minutes before and allow it to come to room temperature. Or you can place it in a hot water bowl or a dish with some warm water. You can place it in that and allow it to, even frozen milk, you have to first keep it in the refrigerator so that it will thaw, and then at room temperature for some time before giving it to the baby.
When my baby, so what happened with me was I had fever for about 4 days, and the baby kind of like stopped asking for milk because I think he figured I was unwell. And my pediatrician told me, if he stopped asking, then don't, now go and ask him to have it. Like, let him just be unless he asks you on his own. But what happened was it caused a boil, sort of like a lump in my breast, which became extremely excruciatingly painful. Is that common when, does it happen to a lot of mothers, especially with working moms who start going for work? They can't feed, right?
Correct. So when you abruptly stop feeding, your body has still not got the signal that you don't have to feed. So the body is still making milk according to what your baby needs, and so the breast will get engorged. And if you don't remove it, then you could get clogged ducts, which can be really painful. So what a mother can do to prevent that is, one. When in your case the baby stops, so what you could have done is maybe hand expressed milk from your breast till the breast became comfortable. So never let a breast stay hard and full for a long time. The milk needs to be drained. But if you drain too much, then the body is going to make more milk, thinking that the baby has, your body doesn't know if you're expressing or the baby is drinking. So you have to drain only till the point of comfort, so that your breast is not hard and engorged anymore. So if you keep doing that, after a point, your body will understand that, oh, now the demand has reduced. Only so much milk is being removed. So I will reduce. So if the baby abruptly stops, that's something you can do. If you're going to work and your breasts are engorged, you will have to, if you still want to continue breastfeeding your baby, you will have to pump at work to avoid engorgement. So that is one place where workplace can really come forward and support mom by giving her that time, giving her that space, personal space, having a refrigerator where she can store the pump milk to take back home. So those are some things that the workplace can really come forward and do to support moms.
I want to understand, like, does cow's milk, is it a replacement for mother's milk? I mean, can it be used? Is it as nutritious for a baby, or you can top up mother's milk with cow's milk?
Cow's milk is absolutely not recommended for babies below 1 year, because cow's milk, see, in human milk, there are two kinds of proteins called whey and casein. The whey protein is more, casein is less. So in the cow's milk, this casein protein is like very high, and that one is very difficult to digest. So this, because the baby's intestines are still permeable, they are not fully sealed, and this might cause a lot of irritation in the gut for the baby. So cow's milk is not recommended for babies below 1 year as a drink. You can still use a little bit of cow's milk in making their food, or you can use dairy products such as yogurt and cheese to get them introduced to it.
But even yogurt is not good.
Yogurt you can start giving the baby once the baby starts solids. But cow's milk as a drink should be avoided, because in the first year of life, we want them to get all nutrition from breast milk or formula milk. Now, formula milks are really made to closely mimic breast milk. We get very good quality formula milk these days. But the only difference being, breast milk is so unique in its properties. It has bioactive compounds. Under the microscope, you can actually see living things in the breast milk. The immune factors, the antibodies, and so many bioactive enzymes passing on from baby to mother. So formula which is made in a laboratory may not be able to provide such a level of protection and be so custom for your baby. It is there is a difference, but nutritionally it will take care of what your baby's needs are.
If a mother, a working mom, even if she's expressing milk and keeping it in the fridge, and she wants to come back home and feed the baby in the night, want the baby, because suckling from a bottle is so much more easier than suckling from a mother's breast, want the baby just like not want to suckle?
So if the baby is really young and you introduce a bottle, the baby might have a nipple preference, because you said sucking from the bottle is really easy. Breast requires effort. But if a baby is slightly older and has been breastfeeding for a long time, when the mom comes back home, the baby will want that connection with mom and want to get back to mom. So the baby might prefer, because the baby might be missing breastfeeding during the day, so the baby might prefer breastfeeding rather than a bottle once baby sees mom. But yes, if you introduce it within the first 50-60 days, maybe the baby will develop a nipple preference.
And then is it difficult to get that baby to again switch to breastfeeding?
It could be slightly difficult with some babies, so we need to work with, again, cutting down on bottle and this thing. We also encourage maybe cup feeding or spoon feeding. Babies can start drinking from an open cup right from 6 months. You can hold the cup, slightly tilt it. Even if we are doing bottle feeding, we recommend responsive feeding. That is, if the baby is not willing to drink, turning their face side to side, then we should not feed the baby forcefully. Because
but
in a bottle
feeding causes the baby to gulp more air, no?
Yeah. So for that, if you keep the bottle vertically, the baby has no control over how much the baby is drinking. It will just flow and the baby will keep gulping. So we want to use bottles with small nipples, and we want to tilt the bottle slightly, let some milk go in, and then again tilt, make it horizontal. So baby, we are trying to create that same suck and swallow pattern that the baby would have to do in breastfeeding. So there is this way of paced bottle feeding, it is called, that will help the bottle feeding to not be so easy, and the baby will have to take some kind of effort to bottle feed also. Slow flow nipples and paced bottle feeding will help.
There is this growing, a trend of natural birthing. So, what is this natural birthing, and is it actually like why is this? Why is it a growing trend?
So, as more and more moms are attending childbirth classes, they want more autonomy over decisions taken at the hospital. They want to give their informed consent for all the procedures that are happening. And there's a lot of knowledge that is being shared about birthing and natural birthing and its benefits. More and more moms are naturally drawn to it. They want to be able to not take any kind of medications during birth. So for an unmedicated birth has its own benefits, right? Your body is able to recover quickly from an unmedicated birth. You are tuned into your intuition, so it is easy. You are when you don't have medication attached to you, you are free to roam around. You are able to use various positions. So gravity greatly assists during birth. If you see in olden days, many of my grandmothers and their friends will tell me that they used to squat when birthing. They had this rod that they'd hold and squat down, and they'd say birthing was so easy. So it's a very recent development that we have women lying on bed for birth, which does not allow gravity to help the way it can. So when women learn about the mechanics of birth and how easy it can be if you do not interfere unnecessarily, and if you just let it happen in its own pace, if you do not induce it when labor starts naturally, there are so many benefits. So we learn about how women can cope with pain during labor with various breathing techniques, with changing positions, with some massage techniques. Women opt to have doulas as continuous support, because many times it's a new experience for your partner also. Your partner is not going to know exactly how to support you and how to give you what you need during labor, whereas doulas are trained to do that. They are trained to give you informational support that will help you make the decisions that you feel are right for you. They are trained to give you physical support by giving you touch, massage, by helping you walk, by helping you assume different positions, by breathing with you. They are here to give you emotional support in terms of encouragement, motivation, reassuring you that everything is going well. So a lot of women are opting to have doulas for their birth, and even hospitals are becoming more open to the idea of having a doula in the labor room. And there is lots of evidence for how having a doula benefits a woman. There are lower rates of C-section. There is a more positive birth experience for the mother. And when birth goes according to what a mother wanted, breastfeeding becomes easier, bonding with the baby becomes easier, recovering in postpartum becomes easier. So it is all connected. We often try to look at it as different milestones or different phases, but it's all connected, right? Birth flows into postpartum, flows into breastfeeding, flows into parenting.
So, does this mean that a woman who undergoes C-section actually struggles to feed her child as compared to a natural birth?
There will be slightly more challenges because both women and some of the medicines could reach baby also. They will be drowsy. They will need time to recover. C-section is a major abdominal surgery for a woman, so she'll be in recovery for some time. The initial skin to skin might be interrupted. You can still as part of your birth plan, ask that the baby be put on you even while the surgery is being completed, as soon as the baby is out. But these things will happen only if you ask for it before you get into that room. So you could still breastfeed the baby while you're still in recovery. There are certain positions that can help. So if you are in a laid back position and have someone help put the baby on your chest, baby can self attach. If you are able to turn to your side, then you can feed in side lying position. When you're able to sit up, you can use a firm pillow. You can use a football hold or a clutch hold, in which the baby will not come in contact with your incision. So these are some things a lactation consultant can help you with, how to position baby so that both you are comfortable and the baby's latch is not compromised. Also, it is encouraged that a C-section mother has someone with her all the time, because she might not be able to move, but it's still necessary to feed the baby every 2 or 3 hours, so the baby can be brought to her. So that kind of support is needed for a C-section mother. But breastfeeding is totally possible even after a C-section.
So, as a doula, do you ensure that the mother's birth plan that she has chosen is actually executed by the hospital?
We do advocate for the mother. We do not make any medical decisions on the mother's behalf. All the decisions are the mother's. We do not give any medical advice as such, but we help her ask the right questions to explore what is it that she wants. So she feels that every decision that is happening in birth is being taken by her, and she has a say in what is happening to her, and that leads to a positive birth experience. Because so many moms I've worked with felt that, something unnecessary happened at birth, or somehow they had no control over what was happening, and that is what a mother remembers from her birth. Whereas if you have a doula who's advocating for you and supporting you and making sure your consent is taken at every step, you have a more positive memory of your birth experience. And it could still be a C-section, it could still be something unplanned, but you were able to cope with it better because you felt like you were part of it and it was the best decision for you.
What are the most common trends you see, with respect to actually it being a very small thing and it's generally perceived to be a challenge by most mothers? Are there some things, some trends that, maybe somebody can just be like, okay, if this happens, it's fine, I can just ask?
So many times mothers worry about many things. They think, okay, it could be a big problem. Say, for example, a mother is worried that her baby is not gaining weight. But when you, as a lactation consultant, go and ask the mother a few questions, you understand that, okay, maybe this baby is sleeping 4-5 hours at a stretch. So initially, we recommend that even if the baby is sleeping, the mom needs to wake the baby up every 2 hours to feed the baby
Is that necessary?
till the baby regains birth weight, at least for the first few weeks of life. So, but many mothers, like you said, don't know that. They think, okay, baby will ask for milk when the baby is wanting milk, but maybe the baby is having low sugar, or baby is feeling weak enough, so baby needs to regain birth weight. And so certain things like this are missed, which are very, very simple.
One of the things is all my friends are in US. They all had their babies in the baby cot, but that's not something I did. And is that advisable? Like, I personally never advocated it or I never followed it myself, but I do know of a lot of people who do that.
So again, it boils down to personal choice. Different families have different sleeping arrangements, but from an evidence point of view, co-sleeping is safe. Many parents have this fear that if they are sleeping next to baby, then they might do something that's unsafe for baby. They might block the baby's nose with a blanket, or they might put their hand or their body over the baby. So that kind of fear is there. But you will be alert when the baby is next to you. You just have to make sure that your sleeping place is safe. Baby doesn't have a chance of falling. Baby doesn't have a chance of blanket covering their face. And you are maintaining you have your own thing to cover your blanket to cover yourself, and baby is not using the same blanket. So if you make sure that certain things are in place, co-sleeping is absolutely safe. In fact, it helps the mother get more sleep, because every time the baby gets up, the mother can just feed lying down. Another belief is that side lying is not advised, or is dangerous, or leads to more infections.
When you say lying, you mean the baby is sleeping in the side, or the
Baby sleeping on
next
the side,
to the mother?
Next to the mother. Mother is also breastfeeding in that position. Mother is turning towards the baby.
But won't the baby choke while sleeping and
so
drinking?
you can feed in side lying, but the only thing is, if it's a very small baby, then you can't sleep while the baby is drinking milk like that, because you need to be a little watchful of because if you sleep off, and there is a chance that baby is still attached to the breast, nose might be blocked, or you, even if you're sleepy, maybe make sure that someone else is burping the baby and positioning the baby safely. But with an older baby, it's absolutely okay to do side lying position, because if you see, even when you're breastfeeding in a sitting position, baby's body is still towards the side and in the same position, right? So positionally there is no change for the baby, if whether you're sitting or whether you're side lying. So you can feed in the side lying position from the get go.
Divya, how can young parents reach you if they want to?
So I have my Instagram handle, and which is momsense.in, and the phone number will be in the description, and they can reach out to me on either of that.
Thank you, Divya. This has been such an exciting and such an enlightening conversation. Me being a mother, I wasn't aware of so many aspects of the conversation that we've had so far. I'm really glad that you came in.
It was a pleasure talking to you, Rashmi. I really enjoyed it. Thank you.
Stay tuned for the next episode, guys, and please subscribe to my channel so that I can have more experts like Divya talking about aspects of health which are very pertinent and important for all of us to know. Thanks.